Good afternoon. My name is Mauda Monger, and I will be presenting on Abstract 060104, the role of OB-GYNs in optimizing PrEP delivery for Black women. This project was proposed as a result of the rates of HIV among Black women in the United States, but specifically in Mississippi. As it relates to Black women in HIV, 50% of HIV diagnosis among all females consist of Black women, though they make up only 13% of the female population. As it relates to transmission, 91% of HIV diagnoses among Black women are attributed to heterosexual contact. As it relates to deaths, 57% of HIV related mortality among women are Black women. The disproportionate rates and vulnerability of Black women were the driving force to address the issue of PrEP usage and uptake among Black women. Research has indicated that Black cisgender women account for only about 2% of PrEP users among PrEP eligible people, despite being one of the most vulnerable populations. As it relates to PrEP knowledge, one research study found that less than 30% of Black women had ever even heard of PrEP as an option to prevent HIV. The rates in Mississippi are not much different. In Mississippi, 70% of the people diagnosed with HIV are African American. As it relates to women, 80% of those women diagnosed with HIV are Black women. As it relates to PrEP usage, less than 10% of PrEP users in the state of Mississippi are Black women. To conduct this research, we utilized a community-based, human-centered design to inform a PrEP health campaign video series. How did we do it? We actually conducted focus groups, 6 focus groups utilizing 20 women, inviting 20 women to join us between the ages of 18 and 54. We also invited community stakeholders, providers, hairstylists, faith leaders. We invited them also to join the conversation on how do we create a PrEP campaign that will increase PrEP uptake and awareness among Black women. Though our goal was to consider how to increase PrEP uptake in a media campaign, something else emerged. Who should be giving the message around PrEP? Who was trusted, knowledgeable, and relevant? Participants identified OB-GYNs and primary care providers as trusted, relevant sources for PrEP information, specifically because of their already established roles with having conversations around contraception, pregnancy, and STIs. So, what did we find? After conducting a reflective thematic analysis, 7 themes emerged. A couple of them I've already mentioned: that OB-GYNs were trusted sources, that they were a place of comfort and trust. But we also found that there was a huge need for provider education and engagement. Providers needed to be trained on how to manage, introduce, and maintain patients on PrEP. More importantly, that there needed to be some coordination across care settings. These themes led to the following implications. Black women and community stakeholders all agree OB-GYNs and primary care providers are an additional avenue for PrEP promotion. But more importantly, that there needed to be specific implementation strategies to increase PrEP uptake among providers. Not just the public, but providers needed some guidance on how to increase PrEP uptake. There is work to be done. OB-GYNs and primary care providers may be the missing link to address PrEP uptake in Black women. Let's connect and have a discussion.